gentlemen, this is your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. So today we have a very important topic, very important topic in the sense that my own field is also microbiology, and today we have an expert microbiology with us, Dr. Ayesha Farooq. She is serving as a senior scientist in National Institute of Health, and she is leading the microbiology laboratory there, and she has a lot of experience being a medical professional, and she has done FCPS, and now she is a microbiologist leading the microbiology laboratory in National Institute of Health. And our topic for today's discussion was solving the national problems through microbiology. So how microbiology can help us to solve the problem, because this is also my own field. I always love to talk about the microbiology. This is very important because many of the national problems we can solve through microbiology, and we are also facing so many challenges in the field of microbiology. As per the format of program, we often talk about the educational journey of our host and the career journey. So this is what we are also going to do today. Unfortunately, due to traffic issues, our guest, she couldn't join us early on the time because we were also got stuck in the traffic. So we are going to start very late. So we'll have not much discussion today about the projects related to microbiology, but we will definitely ask us initially about our guest educational journey and the career journey, and some of the things she is doing in her laboratory at National Institute of Health. And we will inshallah ta'ala invite her once again in our upcoming program, and we'll discuss in detail about today's topic, that how microbiology in different forms, like microbiology could be the biofertilizers, microbiology could be the vaccines development, microbiology could be to solve our food issues, microbiology could solve our agriculture issues. So microbiology is there to solve many of the problems. So how she is solving, how she is doing the surveillance, what are the recent challenges in the form of antimicrobial resistance, so how they are looking at these problem of antimicrobial resistance in Pakistan and also rest of the world, and many other challenges that we are going to discuss today. So let's start with Dr. Ayesha. Thank you so much for joining us today, although there was like bad traffic outside, but thank you so much for like making it to the studio today.
Sure.
So please tell us about your own educational journey, from where you started, what was your motivation especially to go towards microbiology.
Before starting, I would like to ask, should I go bilingual or is it compulsory to?
It's better to be in English because
Okay.
this is dedicated channel for like we speak in English.
Okay.
The others are like more in Urdu and are bilingual.
Okay. My name is Ayesha, and I'm from Punjab, and I'm a medical doctor, and I have done post-graduation in clinical microbiology. We call it FCPS, Fellow of College of Physicians and Surgeons.
Right.
And educational journey is like, it's like a life journey. I have started back, my father was in army, so we were being posted to different locations, and once I was in class prep, then afterwards we were posted in North Waziristan, in Razmak. It was a very good place back then. There were no problems, but there were no good schools at that time. So we went to a school. There was no faculty there. Some of the officers' wives, they used to taught us, and there we had books of Pashto as well, and so there we spent almost 2.5 years, and in those years we learned whatever we learned, but that hiatus, that gap, when we joined class 3 in Quetta later on staff course, it was very difficult for me to cope. So one of the things I remember from my childhood is that my father gave me a dictionary back then, and he instructed me how to use that, and it was very difficult in the beginning, but after that till now I'm used to use a dictionary. And whenever I stumble upon a word which is not known, or which is the connotations or the meaning is not clear, I refer to dictionary. Even before my exam, I had to abstain myself from using it. But this habit helped me a lot because any word which is not clear, I prefer to clear it and then go beyond.
Mm-hmm.
So
Interesting.
uh, later on, I opted for MBBS. I have done my MBBS from Fatma Jinnah Medical College, Lahore,
Okay.
back in 2006.
Mm-hmm.
And then uh, during my journey, I was interested in microbes, microbiology, vaccines, mycology.
Mm-hmm.
So naturally, I was inclined towards the field of microbiology.
Right.
And initially, it was like everybody who is in the medical community who is interested in microbiology,
Mm-hmm.
naturally they tend to look at it in the perspective of infectious diseases,
Right.
not only microbiology.
Mm-hmm.
So I was interested in infectious diseases first,
Mm-hmm.
but it is like a second specialty for doctors in our country. First,
Mm-hmm.
you have to go through 4 years of medicine or 4 years of pediatrics training.
Right.
Then you have to opt for a second fellowship of infectious diseases.
Mm-hmm.
So it was a long journey for me. I have young children, so I opted for pathology or the laboratory side of microbiology
Okay.
and infectious diseases. So
Mm-hmm.
this is
Like, this is what I also wanted to ask. Like, most of the like doctors, they go in different areas like pathology, and
Yeah.
also like they go for gastroenterology and
Yeah.
other kind of things. So it's rarely somebody seen they have like, I haven't met many microbiologists. So what was your motivation to be in the microbiology?
uh, I used to see into the world of microbes in a different way, always.
Mm-hmm.
Even now, when I'm a medical microbiologist, I tend to see microbiology as, a 360 microbiology. I tend to think whatever is going on in soil,
Mm-hmm.
what is going on in rhizosphere, what is going on in other fields of microbiology. So I tend to think in a bigger perspective,
Mm-hmm.
and it keeps my interest alive in this field because there are lots of opportunities which are not being availed
Mm-hmm.
even now.
Mm-hmm.
And uh, it is like a story. Microbiology is like a story which needs to be taught to other people. It's there are many domains which are not explored till now.
Right.
So my motivation was that I have to be inside it, and I have to make people see how I see microbiology.
Wow, that's
So-
interesting. So, like, we often see that medical is the highest degree, and as you have started the conversation, that you have like spent the early education in RISMIC and then in Quetta, and it was really hard to find any faculty there. Even
Yeah.
like, if you are motivated, if you want to do something, you can do like the medicine in
Yeah.
Pakistan, starting like without any school almost, and then being a medical doctor. So if you have like motivation to do something, definitely you can do it. And your story is, I think, an inspiration for so many other girls who want to opt the field of medicine or any other degree which is like space science or neurosciences.
Yes,
They
of
can
course.
definitely go for it if you have a strong motivation for that. So next thing, we want to learn more about your career journey. So from where you started and till your current position.
After when I did my MBBS, after my graduation, as we say it, many of my colleagues they say that it's easier for a lady to opt teaching. So they urged me. At that time, FCPS was not that much prevalent in Punjab.
Right.
Only there were a few institutes in which postgraduate training was in process. So I was in Lahore, and there was no institute offering FCPS.
Right.
So I opted for MPhil microbiology. But
Nice.
when I went to the section of the hospital to take some decision, most of my colleagues, they said, don't opt for microbiology, you must opt histopathology, because in that way you can teach in medical colleges. You see, we tend to limit our scopes and our journeys by these things. I think so. I opted for histopathology on my MPhil admission paper. Then I went back the next day. I came back and I requested the people, and I said I have opted incorrectly, so I have to rewrite microbiology. And after that, when I got my chance, I opted for my training, and my training was from Armed Forces Institute of Pathology, AFIP. It's in Rawalpindi. It is like the year 2012, and back then it was the only institute in Rawalpindi, Islamabad, which was offering the postgraduate training. So this was the way I landed here. And during my journey, after I got married, we shifted to Muzaffarabad. It was post-earthquake era, and it was like many of the NGOs were there. So I worked for a few months in Caritas. It was an NGO, and we used to do field visits and OPDs.
Okay.
And in that, I see that I observed that there were lots of common problems with the common people, and we need more GP or general physicians.
Right.
Or we don't need all the specialists, which is now the trend in our country.
Right.
And one of the things which just came to my mind when in our ceremony, when we have offered the degrees, there was a special session by CPSP, College of Physicians and Surgeons, Pakistan. There was a special session about family medicine.
Okay.
Family medicine comprises of all the common things which occur day-to-day medical practice, and most of the people, they opt for to become a specialist in some specific field, but we need generalists as well to solve the problems. So I have decided that I will do my own training, my own OPD, and I do it sporadically, and I aim for a full-fledged medical setup in which I can act as GP, work as GP, and my training of infectious diseases and microbiology, it can back up.
Right. And then how you started your job in National Institute of Health?
Okay, after I completed my FCPS degree, I opted for a few jobs. First of all, I joined Excel Laboratories as consultant microbiologist.
Okay.
Its main branch in Blue Area, Islamabad, and there was a very good thing in that with that lab, and it was that it was offering locum slots for doctors.
Okay.
If you want to come for 2 hours. For 2 days, it's okay. If you want to come for 6 hours for 1 day, it's okay. So it was offering flexible duty or work routines. That was very good for me back then, and I was inspired by their their method, and I think there should be more opportunities for people here. So, we can use our workforce more in a more efficient way. In that
Definitely.
manner. After that, I joined a medical college. It is Islamabad Medical and Dental College in Bara Kahu Satra Mil, and Akbar Niazi Hospital was the attached hospital, and I worked as assistant professor there for quite a few months, around 6 months.
Right.
And then I got selected at NIH as senior scientist, and then I joined NIH back in 2019.
Wow, so you have quite a long time there, like it's 6 years now. Okay, so because we wanted to discuss in detail about different aspects of microbiology, but today due to shortage of time, we just wanted to learn more about the kind of projects you are doing in your laboratory, so we can have an overview, and then we can later on we can discuss in detail that what is the impact of those projects, what are real challenges that we are facing these days, and how we can solve those. So we'll definitely discuss in detail all those aspects, but briefly if you can highlight some of the things that you are, because you are the head of microbiology, as serving as a senior scientist there, so what kind of activities, what kind of projects you are doing?
In our laboratory, because microbiology department of public health division, it is a national reference laboratory for microbiology. So we are working as a routine diagnostic microbiology as setup as well, and we have a stream of epidemic samples which we receive from all over Pakistan through the district health services, and like for diphtheria, pertussis, cholera, and other vaccine preventable diseases like salmonella. So we receive different samples from whole of the country, from all the provinces, and we deal those samples. And EPI, or expanded program of immunization, that is also like we work together, and because this data feeds into their system so that they know from where the cases are coming.
Right.
In this way, they can direct their vaccination efforts to those affected areas.
Mm-hmm.
And another stream of dealing is the research stream or the projects going on. Recently, we have completed typhoid surveillance project, cholera project, surveillance project, because when there was cholera outbreak in the country, then the samples they were dealt with in the reference laboratory of microbiology in our
Right.
laboratory. So we were aware of what is going on, from which areas, what samples are coming.
Right.
And for other projects, we are currently dealing with CRE project. It is carbapenem resistant Enterobacteriaceae, and previously we were dealing ESBL tricycle project.
Okay.
It's a project about One Health. Like One Health, as a conceptual basis, it says that if one of the domains of health is not healthy, then everyone, all the domains, they are not healthy. For example, plant health, animal health, and the human health, all these things are interlinked.
Right.
So we were dealing with ESBL project. ESBL stands for extended spectrum beta lactamase. It's an enzyme which most Enterobacteriaceae or gram-negative bacteria, they elaborate. And this project was like from environmental sector, from veterinary sector, and from human sector. We have to isolate E. coli, which expresses this particular enzyme, so that we see like what is going on in terms of antibiotic resistance, and what are the type of bacteria, what is their journey. And so CRE is a sort of upgradation, because carbapenemases are also elaborated by the same microorganisms. So these are some of the projects, and currently there is another project of wastewater surveillance for antibiotic resistance determinants. It is just being started at NIH. Different teams are involved in different projects, but these are some of the projects.
Yes, they are quite interesting, especially like the wastewater surveillance. That's also very important. Whatever we have to know, like if we want to know about the polio, for example, how much we have in our water sample, we can get to know. Even I know one of the project that was done by NIH was knowing the COVID through the wastewater.
Yes.
So how, like, what is the concentration of these COVID is in different ways. So that's also one of the way. So it's this very interesting discussion, knowing like in real time what are the challenges, and especially as you have mentioned about the cholera epidemic that happened in different years, and then you get the real time data, what are like the hotspots in our country, which area is more effective, and so on. So these are the real. So in Pakistan, we often talk that the health infrastructure is not that strong, and there are so many challenges. So definitely all these aspects, especially the antimicrobial resistance, is often called the tickling bomb in the world, because if there will be more antimicrobial resistance, that is like in simple term, if somebody says, we'll definitely, I think it's best to ask you, so what is this antimicrobial resistance? Then I'll I can explain it a bit more. So what is this AMR, and how big is this problem?
I think it is a buzzword, AMR, nowadays, but I think if different people can look up to this problem in a different way, and everybody, every field, they have their own perspective. But I think it is multifaceted issue, and before being described it being described as a problem, we need to see how that. For its solution, everybody has to come together. Antibiotic resistance is that the antibiotics or the chemicals, most of them are synthetic, which we are using in order to deal with the infections, bacterial infections or viral or fungal infections. They are being ineffective, the antibiotics, because or antimicrobials, because bacteria or viruses or fungi, they have developed resistance, and they are not responding, So first they become tolerant because of continuous bombardment of these antimicrobials. As they say, the one thing which doesn't kill you will make you stronger. So this is the same scenario with antibiotics, antimicrobials, and the microbes, because microbes are being exposed with sub-therapeutic quantities of these antimicrobials. Most of the times, because antibiotics are used in as plant growth promoters. They are used in animal husbandry practices. They are used in animal feeds. and they are used in hospitals and other setups, and most of the time they are used injudiciously, and they are used when they are not needed. Until now, most of the people dying as a result of AMR, they are not dying because they are consuming too much antibiotics. Most of them are dying because effective antibiotics are not available at appropriate time. Most
Right.
of our children, most of our people are dying because of this. Antibiotic resistance is an issue,
Right.
but this is another important thing.
Another thing that I just want to know, what kind of fungal problems are like you are going to address? And because I have learned that fungal diseases are also becoming a challenge to the world. So what kind of like projects you are working in your laboratory? Are you doing some surveillance? What kind of fungal diseases are coming? And what kind of projects you are working in your laboratory?
In our microbiology laboratory, currently there is a project of fungal surveillance and Candida auris surveillance, more specifically, because Candida auris is a yeast, and in recent years it has been quite a problematic fungal pathogen all over the world, because
Right.
it is resistant to so many commonly used antifungals. And as far as surveillance is concerned, we are currently doing surveillance for Candida auris only.
Okay.
But as our country is basically an agriculture country, and most of the fungal pathogens, they are saprophytes, they are out there in the environment, and many of the serious injuries, serious fungal infections, they are because of the penetrating wounds out there in agriculture field and or environmental area. And these fungal infections, they are very resistant to commonly used antifungals.
Right.
And I think one of the reasons is that antifungals are very commonly used in agricultural practices.
Right.
And
Yes, definitely. We
Yeah.
know that like there are so many plant diseases, especially
Yeah.
even if you talk about the strawberry, like they are very prone to the fungal disease, and
Yeah.
there are so many antifungal being sprayed on those strawberries and other
Yes.
fragile kind of fruits. So you are quite right that these are antifungals. They are like in agriculture sector, they are so much use, and we have to work on other technology. So there is a lot of things to discuss in sector of microbiology, especially what kind of like what are the prevalent diseases, what are the prevalent viral diseases in Pakistan, and what are the prevalent bacterial diseases and fungal diseases in Pakistan. So how NIH is doing the surveillance, how NIH is doing the research, how is NIH is working on the vaccines and many other aspects of these microbiological issues in Pakistan, and how we can strengthen these projects, how we can develop the international collaborations, how we can develop the national collaborations, how we can develop the clusters in Pakistan, cluster on the basis like how we can improve, have the cluster working on the fungal diseases, on some specific, for example, typhoid. She has mentioned that is a growing problem in Pakistan. We know so many other diseases, they are so prevalent. In hepatitis is a big problem. So as we know that Pakistan is now in number one in hepatitis C cases. So
Yeah.
these are very, very important discussion, and we definitely talk to the experts, just like Dr. Ayesha. She is here today in our studio. So we'll continue the discussion as time is up already. So we are very much thankful to Dr.
Thank
Ayesha
you
for
so
joining
much.
us today in the studio, and we will definitely request her to join us in the coming week so we can discuss in detail about these issues of AMR, the fungal diseases, the bacterial diseases, the vaccines, how much we have done in Pakistan, and also what we can do in the future. So at the end, we request you to please just share one message for our listeners about the microbiology. And just like you have, one of the message is very important and very clear. We need to rely more on GPs rather than the specialists. So
Yeah.
rather like running to, if for a common problem running to a specialist, we should go to the family physician or GP first. So this is one of the message. I think that is very well taken. What else you would like to say today to our audience?
I would like to say that in my journey, I have seen that there are lots of people who have specialized capabilities of doing research and in academia, in different institutions. There is just need of making bridges between academia, between the research institutes. I think if we make these bridges, then it will be very easy to make a systematic, framework in which We have manpower as well. We have students. We have very brainy students, but we have to work together to make bridges, not ditches.
Thank you very much. So, massive, very important. We have to, just like we were discussing, we have to develop the clusters. We have to bring together the academia, industry, the institute. They should work together because we have the limited resources in Pakistan. And if we can join our efforts, and this is also from the National Academy of Young Scientists, we also working very much on the collaboration. So this is one of the things that we also do, and all the other institutions, if they have like focus on bridging these gaps, definitely we can create a huge impact in Pakistan. So once again, Dr. Ayesha, thank you for joining us in studio.
Thank you for
and
inviting.
we will definitely invite you once again so we can discuss in detail the other aspects of microbiology. Thank you for joining us, everybody.
Okay, thank you.